Good evening, everyone. Before we start today's session, I would like to spare some time to introduce Ascension and tell everyone about today's session. Ascension, a step above, is a one of its kind annual conference and also one of India's few medical humanities conferences organized under the aegis of Dr. M.V.L.Kothari Chair and Division of Medical Humanities in association with the student body of St. G.S. Medical College, KEM Hospital, Mumbai. Today, we have the grand and final event of Ascension 2020, which is a panel discussion on the topic of enhancing the doctor student relationship. We at Ascension believe that the student professor relationship is one of the most vital building blocks for making of a great doctor. The professor is the potter who shapes not only the clinical expertise but also a student's approach towards the patients. But unfortunately, due to a variety of reasons, the nature of this bond is changing rapidly. So today, we aim at keeping a unique and fruitful discussion between a panel consisting of both the students and teachers, where each party can openly place their views, exploring causes of this so-called deteriorating relationship, and most importantly, find solutions to bridge the growing gap. So, I would now like to hand over to Sakshi to introduce today's panelists.
Good evening, all. So, we are very fortunate to have such a great personalities with us today for this unique panel discussion. So, today we have on our panel four very estimated faculty members. So, I would like to introduce first panelist of today's discussion, Dr. Avinash Supesar, ex-dean and director of said GSMC and KMH, and currently working as executive director at Hinduja Hospital. So welcome, sir. Next is Dr. Vinaya Shah, ma'am, professor at Department of Pathology in HBT Medical College and Cooper Hospital, recipient of Pro KC Basu Malik Award, got Famer Fellowship in 2007 from GSMC. She set up second MBBS teaching curriculum museum in HBTMC College for 150 students. So welcome, ma'am. So our next panelist is Dr. Surendra Shivalka, sir. He is a professor at Department of Physiology and at GMC Mumbai. Next panelist is Dr. Girish Gadekar, sir, professor and head at Department of Orthopedic, chairperson of Students Welfare Cell, MGM Aurangabad. So I welcome all the teacher panelists and we are totally honored by your presence. Thanks a lot, sir and ma'am, for taking out time for us. So now we have six very talented panelists with us today. I would like to introduce them one by one. So first is Dr. Amey Kamdar, intern at KJ Somaya Hospital, Mumbai. Next
Thank
is
you.
Next is Pranav Suravase, third second MBBS student at SAID GSMC and KEMH.
Thank you.
Next is Ojas Krishnani, third second MBBS student at SAID GSMC and KEMH.
Thank you.
Yes. Next is Migdali Shroff, third second MBBS student at SAID GSMC and KEMH. Next is Akash Sethi, third first MBBS student at GMC Baroda. And next is Shirish Rao, second MBBS at SAID GSMC and KEMH. So I welcome all the student panelists here. And to moderate such a varied and interesting panel, we have today with us Dr. Arnav Tongavkar, sir, MD Medicine at SAID GSMC and KMH, and he is a past student of KM Hospital also. So welcome to all, and we are eagerly waiting to hear you all. Now I will hand over to Purva and Darsh for giving us details about today's panel discussion further. Thank you.
Okay. So today's panel will be discussing general points. It will be in the form of points raised by students, answers, and new points raised by teachers, followed by a short single question answer round. This will happen until all the speakers are spoken up, followed by open discussion for new points to come up on the panel. This will be followed by concluding speeches by the two sides, and finally a concluding remark by the moderator. So this will be the format we'll be following today. And I'll now hand over to Dr.M.V.L.Kothari, sir.
Good evening, one and all. It feels a bit strange to be called a former student of KEM. I mean, it's been less than a week since I've completed my journey at this prestigious institute. And I really love the topic for today because it's wonderful to be speaking on the student-teacher relationship with so many of our eminent professors with us. They are going to be speaking a lot of beautiful things, so I'll keep my introduction really brief. What I feel personally is that each student connects with a different type of teacher, and each teacher connects with a different type of student. So you end up linking yourself or relating yourself with one teacher who you really like, and that sort of defines the path that you take ahead. And personally, I've been really privileged to have a lot of wonderful teacher mentors at KEM Hospital. And the other thing that I would like to mention is the student-teacher relationship is a journey. There are bound to be ups and downs, there are bound to be problems. And we are here today not to highlight the problems, but also to look for the solutions. Definitely, it is each side that shoulders a portion of the blame. And when we look at ourselves, it is very easy to find fault in somebody else, but very difficult to analyze what mistakes we are making personally. So today we hope that in an open panel discussion, we can understand both points of view and try to find a middle path so that we can work together. Thank you. I would like to open the panel discussion by inviting Ojas to begin the speeches from the student side.
Thank you for this opportunity. I would like to start today with a statistic. In 4 medical colleges of Delhi, students unsatisfied of lectures and clinical postings were 76 and 86% respectively. This brings us to an important fundamental question. Is doctor-student relationship defined just by the didactic lectures and bookish knowledge? The teacher of my college that made perhaps the biggest impact in my life is the HOD of plastic surgery, which is not even a UG department, Dr. Vinita Puri ma'am, who was the mentor of our symposium team and an inspiration for me to become a surgeon. Perhaps the thing least taught by her was the bookish knowledge. This makes us question what a real relationship is between a doctor and a student. Are you afraid to ask questions, express your opinions and emotions? If yes, then you have already become a part of the existing system that is ridden with faults. The question that perhaps changed my life was, can we help people decrease substance use? And the response that I got from the doctors of my college and doctors who were not in my college was very different. In this lockdown, we created a team of 90 people who helped 25 people and their families and enabled them to decrease their substance use. But none of the doctors of our college were involved and perhaps not even aware about that. This is the lacuna that has been created from one generation back, where faculties even knew the name of girlfriends and boyfriends of their students, to a state of non-interaction. And I can't help wonder the reason for the current scenario. Certainly, one of the most crucial factors for me has been the huge level of hierarchy that exists in medical schools. I have been told sentences like, how dare you ask me a question? I have been lectured for 45 minutes about proper behavior for asking a simple question to a senior. Ask yourself, who is that you are seeking? Someone to shape who you are, or someone to give you just lectures in a classroom? The thing that has been proven to unite people is a common purpose. So, can anyone blame us medical students for joining external coaching institutes whose faculties ironically belong to government colleges? Recently, AB de Villiers said IPL is better than the World Cup. Can you blame us for praising institutes that in a way give us the attention that we seek, give us the mentorship that we desire, and involves the stakeholders, us, the students, in decision making? An article about doctor-student relationship really sums it up well. If we experience emotional distancing in our education, so will we be able to relate compassionately to a human being in future called a patient? Isn't it ironical that I asked my peers if I was going to fail after this speech? Isn't it ironical that this talk is called doctor-student relationship and not teacher-student relationship? On the occasion of Gandhi Jayanti, these were my experiments with truth. Thank you.
Thank you, Ojas, for highlighting very beautifully the problems that a lot of students will be facing. I would now like to invite Dr. Vinaya Shah ma'am to present the first speech from the teacher's side.
Yeah, thank you, Dr. Arno and Ojas. It was a very good this week. Regarding the points which have been to role of a teacher beyond the information provider or teacher, right? And the failures of the lectures which we have at present, didactic lectures, is it still valid now? You have to understand our position during our times. That is around 25 years ago, when we were doing MBBS. Everything on the medical subject was being taught to the syllabus, and there were no well-defined boundaries or territory in the vast knowledge of the medicine. For example, in anatomy, we had Grace textbook, which is a huge book, and other standard textbooks were also being followed, and they were very voluminous. Hence, attending these didactic lectures was very important and facilitated narrowing down the subject to the tangible limits. That was a sure short way of passing or getting lost in the vast portion of our medicine. Also, with the scarcity of resources in those times, even to purchase textbooks was a luxury, and library was the other source of information which we had. So those lectures were attended by all of us with 100% attendance. But after the advent of internet and technology evolution, there is complete drastic change happening. There is a paradigm shift. Now the information is available freely at fingertips at the click of the button. So accordingly, now with this present scenario, even the teaching learning methods have to be reviewed and evolved in changing times. So the lectures have to be more interactive, and it has to be more emphasis on small group teaching has to be laid down. And actually, all these points have been already taken care of in the new outcome based medical education, which has to be implemented nationally from this year onwards, which Dr. Supe sir will be enlightening us in detail in the end. Then I want to stress upon the relationship between teacher and student. The student teacher relationship, I would like to say, is an actual extension of parent child relationship. It will keep on changing in the phases which the child is going through. School days are different from higher, secondary, junior college, and graduation college. By the time the student has come to professional medical college, he has completed 18 years and is a legally a responsible adult. Hence, the role of a teacher becomes more of a mentor, facilitator, guide, and friend. Also, the new here again, I would like to say stress upon the even the new curriculum, yeah, outcome-based medical education also emphasizes the role of a teacher to be as a facilitator and guide. Not it is de-emphasizes on the didactic lectures also. Here also, I would like to point out the teacher's role can be very motivating also. Here, I would like to share my experience. In 2002 or 3, I was attending medical teaching technology a workshop in KM Hospital, where Dr. Supe sir was a faculty, and I was highly impressed by his teaching skills, which motivated me to do the FAMER Fellowship in 2007. And FAMER Fellowship is regarding your teaching medical technology in Fellowship in Education and Research of Medical Technology. And subsequently, this has contributed largely to my evolution as a teacher. Now, regarding with this, also I would like to stress upon about the mentorship. What the students now, there's a lot of gap happening. To minimize that gap, there is a process of mentorship, which was assigned during your first MBBS as they enter very newly from your 12th standard. So that process of giving mentorship is maybe to hasten the process of communication, but it should not restrict the student from talking to any other teacher they are comfortable with. They can approach any teacher they want with they are comfortable. No strict boundaries need to be maintained. So this I would like to stress upon, so that we can narrow down the relationship. And here, as I said, the role of teacher is more of a friend and mentor than. So all these points are actually being taken care of in the new curriculum, which will be taken by sir in the later half. So thank you.
Thank you, ma'am, for speaking about the evolving pattern of the teaching system and the need for further evolution.
Yes.
You also raised a very beautiful point about how the system needs to be flexible.
Yes.
Even if we change the curriculum and we want to bring in a change, if we make that change itself too structured and rigid, We'll just
Yes.
be replacing the same barriers with new barriers.
Yes, correct.
Whereas what you said about flexibility is exactly what we need right now. And to your point of evolution, I would personally like to add something. There has been a lot of discussion about online lectures
Yes.
versus the traditional chalk and talk method.
Yes.
It was something that was very difficult to introduce into the existing system. But considering the difficulties that we have faced in 2020, this has been almost forced upon us and people have had to adapt to it. So it's not only the pattern, but also the medium of education that is going to be changing over the years, and we have to be prepared for this as well. With that point, I would like to invite a single question each from our teacher and student panelists to each of our speakers. Could we have a show of hands, please?
What do you want actually?
A single question, sir, to the two people, to either of the two speakers.
Sure.
Yes, Akash.
Hello, thank you for having me here. My question to Vinaya ma'am. Ma'am, how do you think that the commercialization of education has affected this student, like the student-professor relationship in general, as well as the introduction of the coaching classes? And to Ojas sir, I have this question. How do you think this student teacher relation in medical college differs from school? And if you could share some like memories of your school, so it will be nostalgic for everyone over here.
So shall I speak, Dr.
Yes,
Arna?
ma'am. Yes, ma'am.
Thank you, Akash, for pointing out that particular thing, as you have said regarding those coaching classes. I agree with you. Now, I would like to just give a background. As you all must be aware, you all have gone through all these points, like attending tuition classes, as you know, are flourishing, and attending tuition classes during your 11th, 12th standard for getting admission to the graduate college has almost become a default need in the present time. After the introduction of the common postgraduate examination, MCQ based, these classes have indeed flourished and target over medical students from second MBBS onwards, and now even the first MBBS students are not spared. So I personally feel that our present teaching curriculum, which is there, is not addressing these needs. And this vacuum gets filled by these private coaching classes or institutions. They take advantage of it. The moment we take the onus on us and start fulfilling these needs in the lectures, the students' dependency on those classes will definitely decrease. And we do cater to various strata of students. Some people cannot definitely afford, but still they are forced to. So that need not happen. And as I said, every system develops as a response to a need. So change also should be a response to a need. So let us change. The change can be done in our teaching learning methodology. Here again, I would like to share my experience during this lockdown period. Uh, I am a very earlier cut teacher time, 30 years of my 27 years of experience. I had to learn. I learned everything online, how to operate, how to go via Zoom. I prayed the professional and I started taking lectures online. That is third term. My students are in third term now. So I completed their revision and tutorial revision classes by taking online lectures via various media. And in that, what I started doing is that, especially general path sessions, which was already taken first term, they generally forget. I started putting those quizzes because all the PG NEET questions are available on net. I started taking related to that particular topic. Pre-session, keep some 10 MCQs related to that. Take the concept or lecture, and post-session, again, solve it along with them. Then that will definitely, and I asked them, the feedback which I got from my students was they really appreciated it. And the overall attendance I got from my these lectures, from online lectures, was more than 90%, which I never had pre-lockdown period before COVID times. Let me, just say it. So this
Right.
was a very good experience. So I feel, yes, there has to be change in teaching learning method. We teachers have to change to this need, definitely. And definitely the students will appreciate the effort we take, and that effort will always be appreciated by the students. So if we want cooperation from our students, you have to cooperate first, teachers. This is my view on this. Thank you.
Thank you, ma'am.
Thank you, ma'am. Be very beautiful point raised by ma'am. we have a discrepancy between our qualifying exam syllabus and our entrance exam syllabus.
Yes.
And this, more than anything else, is the reason that some students feel compelled to go to coaching classes. It is not
Yes.
because they are dissatisfied with their college teaching, it's because they are being prepared for two different patterns of exams. So, if, like ma'am said, the changes have to happen at each and every level so that what they're being taught is what they're being asked, then they don't have to go to two places. That happens at the level of the syllabus, that also happens at the level of the teacher. Exactly as ma'am took the initiative to start including MCQs in her teaching syllabus, that is the sort of thing that we're looking for to bridge the gap. There was a question addressed to Ojas regarding the
Yes.
change in pattern of teaching from school life to medical college.
Yes.
Ojas, the
So thank you, Akash, for asking this. And as students, we face a nostalgia even when we think about school. So there was a difference that everyone might have observed in our school days. Even if the teachers were not in our sections, we knew about them. We knew certain common characteristics. When one said Miss Teacher Sharma, like we could create an image like that teacher is going to come and teach us. But we have to really question, does that happen in our college? Like one of the factors that I think that has changed is the student teacher ratio. Like that is a big factor according to me. And one teacher giving one lecture to 180 or now 250 students is definitely different than one teacher teaching 20 students, which I acknowledge. At the same time, the role of teacher in school was to pass our exams and to make us better human beings. But the role of professors, as I see in college, is much more than that. Like Dr. Avinash said yesterday, that they have a great role in shaping our futures, in shaping our careers, and we are actively involved in this process. So it aches me even more when I say that we are not that close to teachers in our colleges. Like we would definitely, like the entire point of panel discussion is to bridge that gap, and the extracting of the potential relationship that can exist between a student and a college professor. And don't you think even the word shift has been there? Like they were called teachers earlier and now they are called professors, representing some sort of professionalism. Thank you.
thank you, Ojas. A very valid point that he's raised here, and I would like to add another point that we have an age difference. Like ma'am said in her speech, that during school, the student age group is also younger. They are more dependent. Whereas once you enter college, they are also trying to become independent professionals. And somewhere that independence itself ends up interfering a bit with the student-teacher relationship. So it works both ways. Yes, another very valid point that you raised is the volume of students, because it is definitely more difficult to be intimately introduced to 180 students. But again, I am very sure that each teacher has their favorite set of students. I'm not talking about favoritism. I'm talking to the type of people you relate to, which is what was introduced in the mentorship program also. I'll give a short example. I'm speaking a little more than I'm allotted here. But in our MD medicine curriculum, there was a mentorship program where we were allotted mentors as per our personality types, as per a questionnaire that we fulfilled, where you have complementary people allotted to each other. So this is the sort of system that we want to introduce, and this is what happens naturally anyway. With that point, I would like to call, give me 1 second. Yeah. I would like to call Pranav for the next speech from the student side.
Thank you so much, Dr. Arnav, sir. Well, just as we observed in the first discussion by Dr. Vinaya ma'am, she has explained it very well how teachers actually mold learners' knowledge, skills, and attitude. And she has also explained how she as a teacher has gained insight from the students as to how she can improve her learning process. And that actually helps us realize how learning is a bi-directional process rather than a unidirectional one. And learning is experiencing a paradigm shift, as explained by ma'am, that now students aren't just mere consumers of content, but they are actually creators of their own knowledge. And we need to focus on this. And that's why informational lectures or didactic lectures aren't going to be like helpful or useful. They should be ideally followed by discussions. But just as we had observed in our trailer, that isn't even happening. So let me explain the catch here. So for most of the students, lectures are usually the first point of contact with the information about that topic. And it takes time for them to like sink that topic in construct an idea about it, and then discover their doubts and then ask the teacher. So there needs to be a gap between the lectures and the discussions. Probably online lectures can help in this. We'll come forth to this in our solutions. Well, the second and the biggest problem in this student-teacher relationship, which I've observed, is a practice known as pimping. Contrary to common parlance, pimping is actually a pedagogical practice in medical education. It was put forth by Frederick Branchetti in JAMA in 1989. It actually refers to a practice where the attending physician puts forth a series of questions in rapid succession, and these questions are actually unanswerable for the students. And well, sometimes students won't be able to answer it, or sometimes students just try to bluff their way through it, through this encounter, and this leads to they are actually humiliated for this, and like this humiliation can occur in the form of abusing in front of their peers or in front of patients. It can occur in the form of ridiculing, or uh, uh, questions can be asked so obscure that that no one actually knows the answer except perhaps the questioner. This would actually instill a lack of curiosity among the students about that topic. There will be a fear of questioning among the students, and uh, eventually they would fear to acknowledge that they don't know something, or fear to admit their own mistakes. And it can make students afraid to approach their peers or seniors in case uh, uh, before they're performing a risky procedure, and this can actually impact patient safety. Like, if our fundamental communication skills learned in medical training is to confidently communicate knowledge that one does not actually possess, never express doubt, then patient safety would be impossible. Well, can I get just 30 seconds? I can wrap up on the solutions, please. Yeah. So medical teaching needs to adopt the flipped classroom model, in that the lecture can be online. It can be uploaded online, where students can view this content before the discussions. And the questions and discussions should not be based on humiliation, but they should be actually focused on learning, logical thinking, quick recall, self-assessment, and communication with peers. They should be able to defend their own decisions. And these questions can be actually incremental. They can lead from what the student actually know to what the goal of learning is, and they should be interesting, designed to illuminate particular points rather than to humiliate them. And emotionally safe environment should be ensured for students, where they can ask questions, and they shouldn't be just ridiculed. Mistakes should be a signpost for them to, like, which can head them down another path of learning. And I would like to end with a quote that at the end, students may forget what you said, but they will never forget what you made them feel. So this actually explains how a beautiful student-teacher bond should be built. And we can also focus on some interactions outside the institutions, just as Dr. Supe had earlier said, like how had said yesterday, about how we can engage in discussions outside our classrooms, at kattas or probably in sports or some other places, and we need to develop this kind of relationship. Thank you.
Uh, Very well said, Pranav. What we really need to remove from a major barrier today is fear. The point of teaching a student is not to show them what they don't know. They are not
Yes.
supposed to know it. That is why they are the students. If they knew everything the teacher knew, there would be no point. So, what we need to introduce into our system today is a way for students to admit that they don't know something without feeling afraid. And that can come from the teacher side. It has to also come from the students' peers, because I think even more than the humiliation inflicted by the teachers, it's humiliation inflicted by the peers. Everyone is caught in a race where, you're trying to prove the superiority of your own knowledge, always at the cost of someone else. So, as I said earlier, it's both sides that shoulder the blame. Yes, there are certain situations where people in their own defense try to show more of their knowledge and end up squashing somebody else, but that happens both ways. You also have instances where students try to show off their knowledge to the teachers. So this is a very valid point, and we hope to solve this by the end of the discussion. I would now like to invite Dr. Surendra Shivalkar sir to continue the discussion.
Thank you, Arnav, sir. I'm not going to stress on technical terms, or even as Pranav was saying, giving quotes or references from books. No, this is all will be from my personal experiences. So
Yes.
this is something where I've been teaching undergraduate, postgraduate students for the last 20 years. I have been actively involved in the medical education unit in my institution for the last 5, 6 years. So these are all personal experiences rather than being references from books or so. So what basically the topic that I'm going to discuss is how do you get a congenial student-teacher relationship or a bond, and how do you make yourself approachable for the students? So we'll start with the first most important thing: the reason students are unwilling or fearful to approach a teacher. And I think the most important thing in this is the exam-oriented system we have in India. So in the end, the students what they want from a lecture or from anything is what is going to be asked in the exam. Okay, and this is true if you consider the most glaring example is our internship. In our internship, the students are not doing the internship, they're studying for PG NEET. So I think in the new competency based curriculum, this has been taken care of because there's going to be an exit exam which is going to be common as a something to pass MBBS as well as an entrance exam so that the students concentrate on their internship after their third year. Okay, so and the other thing that has been done in this competency based curriculum is formative assessment has been introduced. So because it has been introduced, now students will not or should not concentrate on summative assessment. What is going to take place in the university exam? Maybe this formative assessment will take care of that. The other thing is that there should be from the teacher side there should be motivation and setting, and they should assure the students that there should be no fear of failure so that they come to the teacher to seek advice and guidance. A strict unapproachable teacher who refuses to solve queries or doubts rationally is uh, something which the students consider as a no-no. So the students will never go to a teacher who will never solve their doubts or queries. And obviously, irritable teachers who are sarcastic or who pass snide comments will never be approached. There are some apprehensions on the teacher side also. How do they go and talk to the students, or how do they take their classes? And the most common reason for this is that teachers do not have in-depth knowledge of their subject. So if they do not have an in-depth knowledge, they are afraid they will be exposed. The other thing is they lack communication skills. So they are command over the language. Maybe here it is the English language. Their command over the English language is not there, or they cannot communicate because what we have is students coming from rural areas also. So maybe they cannot communicate with the students in their vernacular language. So either way, if the student does not understand, then he's not going to pay attention. And most importantly, in today's age, when 2020, the clinical side, the teachers are physically and emotionally exhausted uh, after looking after their patients. So then they do not have the time or inclination to develop strong relationship with students. So how do we go about it? What is the importance of approachability, and how do we overcome the barriers between the teachers and students? My first advice always is to all my junior teachers is always greet the students with a smile. There should always be a smile on your face when you greet the students. You cannot be showing irritation when you meet a student. And the second thing is always return his greetings. Whenever he wishes you, see to it that you wish him back. That shows that you are actively involved in the students. The other thing, and this is true from right from school point of view, never carry your emotions from home or colleagues to class. You have had a fight with your wife, and then you're carrying it to the class, and then you're taking it out on the students. I think this has been true in our school, this is true in our college, this is true everywhere. Then you have to treat all students the same. And this is especially important in the medical college because we have slow and fast learners, because we have people from rural and urban areas, because we have people who have studied in English medium and vernacular mediums. And so there is a wide variation in receptiveness of students. Therefore, we have to find a middle path where the fast learners don't get bored and the slow learners can keep pace. Successful teachers are those that have the ability to maximize the learning potential of all students. Students also learn from examples, so treat them with the same respect you expect to receive from them. Never use foul language or threats, and that is common with some teachers. I'll see you in the university exam, or I'm going to be your examiner, so I'll see you then. And that has been true for when I was a student also. I was also told once or twice, this is what you have done, let's see how you pass the university exam. So never use threats. Provide praise and positive encouragement for any small answer or thing that is done, maybe in the exams, maybe in the lecture hall. I think from the student's point of view here, they need to appreciate that the efforts put in by the teacher and always thank him or her at the end of the lecture. Uh, Provide praise and positive encouragement, as I've always said. Be well read in your subject. That is the most important thing. And accept that you may not know all the things, but we'll get back to them later. So whenever you're asked a question, tell the student that I'll get back to you later when I've read it and have the requisite information. Don't ignore their doubts by saying that, for example, it is not there in your exams or it is not there in your syllabus. It will never be asked. Don't do this ever. Always say that I don't know it. I'll tell you later on whenever I get the time to read it up. Use student generated questions to promote deeper thinking. Believe me, half my knowledge has come with UG students and PG students asking me questions, and I have read it up whenever my PG students or UG students have asked me questions in physiology. So, my 50% of my knowledge has come after I started teaching and not before that. Participates in, most important, this is very true, I always used to do this, is participate in students' extracurricular activities. For example, their annual gatherings. Students always appreciate your support in such activities. The other thing is there should be active listening, and this we always say in medical education unit. You should not be always a speaker, but there should be active listening, listening to students' problems, never to be too strict with them. And whenever you're going to listen to them and not rebuke them with every question or every problem they come with, they'll always come to you. They'll never dread not coming to your class. Maintain an open door policy. That is what is there. There should be one-to-one interactions with students, which is difficult. And here I need to correct Arnav sir because he said 180 students. I don't think so. He realizes that from 2019, both GS as well as Grant Medical have 250 intake, and that is really something because MCI or NMC is increasing the number of students intake, but the faculty is decreasing with each passing age. But here, as we said, there should be an effective mentorship program. Why do I say effective? I was in first year in my college, and the mentor that was assigned was associate professor in anesthesia. Believe me, I could never approach her because she used to be always in the OT. I think in the first year, an effective mentor will be either somebody, a faculty member from first year or second year. If you give him a faculty member from the clinical side, the faculty member never has the time, and the students have to go searching for the faculty member in the hospital. That becomes very difficult. So that is one thing for one-to-one interactions. The other thing somebody suggested last time is small group teaching. Uh, in the new competency-based curriculum, this has been advised, but unfortunately, this is contradictory to what the faculty requirement is there in the starting new medical colleges, and therefore this creates problems. But one thing is there, the new competency-based curriculum has started a foundation course, and this gives non-academic interaction with teachers at the outset itself. So you get to interact with not just the non-clinical or paraclinical teachers, but even the clinical teachers. And I'll come to the last point. How do you go about learning in didactic lectures? Believe me, there was an opinion given here that online lectures are the solution. No, I have been taking online lectures and they are not the solution, because when you're teaching, the reaction from the students' face gives you an idea if they have understood the topic or not. So if there is no reaction, if you're teaching and with 250 students, I cannot keep on seeing at the screen for the reaction from all the students. It becomes very difficult for online teaching. So as is said that didactic lectures are an unidirectional process, but you can make it two-way by involving the students with questions, with personal stories or anecdotes. An example or examples from Hindi films. I always, uh, just give me a minute and then I will stop it.
I'm sorry to interrupt you, sir, but could you please move to the concluding point of your speech?
Yeah. I'll just wrap it up. So, in the didactic lectures, what you can do is ask questions, personal stories, anecdotes, examples, encourage the questions and answers, even if there are going to be wrong answers, and uh, do not insult or embarrass students. And the last thing I can always say is that didactic lectures can be made interesting with the help of seminars, quizzes, and what you should know is that in your teaching, you should be imparting knowledge and most importantly, making learning fun. Thank you.
Thank you, sir. Sir has really beautifully covered various difficult points in his speech. If I were to sum it up in one sentence, I would say that the life of a medical student is like a tightrope walk. we need our teachers to be our safety net, so that yes, we are going to fall. Nobody crosses the tightrope in the first attempt, but every time we fall, we know that they're there to catch us. So we have no fear of falling, and we're willing to try and try again. Thank you, sir, for the speech. I would now like to invite Dr. Amer to continue the speech from the student side.
Am I audible?
Yes.
Good evening. This topic just reminded me of my postings in second MBBS in surgery, where we were posted with the exam going batch. And they had obviously taken a case, and the discussion started in the clinic room. Now, this was around the time when most colleges had their festival. So we were sitting there uninterested, not really understanding what was going on. And there, was some whispers that started from our side. So the professor said, if you're not interested, just leave. And in excitement, we just got up and we realized that, maybe he was being sarcastic. But then he was nice about it, and, we ended up leaving. Now, once I went home, I told my parents about this, and they said, "Are you crazy? You're supposed to go and plead and say, 'Sorry, sir, this won't happen. We are very sorry. This is not going to happen again.'" And this, I think, exemplifies the problem that we face in postings, is that it is extremely unglamorous, contrary to what is expected by students when they enter the ward. They imagine themselves running into the ER like some television show and saving lives all the time. Where the reality is that out of a 45-day posting, there might be just one day where you have a dramatic story to tell, but the remaining 44 days are extremely uneventful. Now, that often happens because professors, not because of any other reason, but because of their own excitement for their field, tend to give such examples. So the options are A, either we tone down this kind of narrative in our classrooms, or B, we try to create some excitement through incentives like rewarding students who display good levels of clinical acumen in the clinics, irrespective of academic performance. Now, another suggestion that I see it is to do away with didactic lectures or contract them and merge them with clinical postings. So, for example, if a patient of nephrotic syndrome comes in, let there be a brief discussion about the syndrome with the lecturer, and then the rest of the discussion carries on with the patient being present, with various clinical signs being elicited, with the discussion of the investigations being on the patient. This will not only save the clinician's time, but will also optimize it. One more problem that I see is with journals, because it's often seen to be extremely mechanical and we tend to fudge a lot of information. So instead, why not have a system where you have a logbook, where just after every case is presented, the lecturer or the resident just signs, and if a certain number of cases are not presented, completion is not given. From the perspective of recording medical data, which is also important, one option is encourage students to create case studies and even publish them. And finally, I think the clinicians of the yesteryears were far better because they used to attend and clinical postings with far greater sincerity and regularity. And possibly that is because it used to matter with regards to their future. So for this case, if we can have, say, a 15 to 20% weightage for clinical marks in, say, third MBBS and final MBBS when the PG merit list is released, I think that could attenuate the problem to a certain extent. Thank you.
Thank you, Dr. Amer. Thank you for your valuable views and a better understanding of clinical presentation and a more comprehensive teaching of each topic. Definitely, that is what is required for us. I would like to now invite Dr. Girish Gadekar, sir, to speak from the teacher's side.
Sir, you are muted.
I'm really sorry I was muted. Yeah, good afternoon, everybody. It has been such a wonderful discussion, and I find myself as the only person speaking from outside Mumbai. I'm from MGM Medical College, Aurangabad. And I was really impressed with what Dr. Surendra Shivalkar sir said. It was I wish he was my teacher, but as they always are, like the first year, second year teachers, all of them, we just love them so much because they're always there for us. And as you said, the clinical teachers are the one who we run after. So, well, coming to my topic, it's about shaping of a good clinician and healer, and importance of clinical postings and learning from senior doctors. Now, the clinical postings are the ones like they start in somewhere in about fourth or fifth sem, depending on each college. And when we come, first of all, when I talk to my students in the first clinic, I always tell them that you all wanted to become doctors one day, and like you for different reasons you want to treat patients, you want to save lives, and you want to do something different, you want to change something. And when you see the patients, this is it, like all the knowledge which you have accumulated in the first year, second year, third year, all that knowledge, when you see a patient, that is where you apply it. And in the purpose of your whole knowledge or your whole teaching, medical teaching, is for you to become a clinician. I mean, the exams, all the exams which you give, the real exam is for you is when the patient comes in front of you. The patient will tell you a few complaints and his symptoms, and from that, you have to come out to a reasonable diagnosis. Use your knowledge to come to that reasonable diagnosis, and then with your knowledge of investigations and your knowledge of treatment, you should be able to give a reasonable treatment. Now the question is like why we as like the students, many times the question here is like reasons why the UG students don't attend clinical postings regularly. I think this is something which should be both ways. The students also should understand that this is the core of medical education. The heart and soul of your medical educations are the clinical postings. And yes, it's in the morning. Sometimes it's the new generations, like you wake up till late, you're watching Netflix. Like we have to understand all these things also. And there are many reasons which make you wake up late. But from the teacher's point of view also, we should try to understand, like we shouldn't be very harsh on them, and we should always try and make them understand to the importance of this clinical postings. As I said, yes, many times, like I keep on telling, like whenever your teacher, I'm sorry. Hello.
Yes, sir, you're audible.
Yes, sir.
So I would like to give a small example. Am I audible? Yeah. Yeah. So
Yes, sir. Yes.
Yeah. So I always like I was a average student. I would be honest in saying that. And whenever I used to attend the lectures, especially the clinics, I mean, as many students raised the point, I was always finding it difficult to ask questions. Should I ask questions? Should I, or I'd be made fun of. But in one of those sessions, we had a very good lecturer, a very good professor in surgery, and I asked a simple question, and to which, like to my surprise, at that time he was very happy that I asked it. He said, "Wow, that's a good question, and that's the best question." Though I don't know how good the question was, but he still respected that question. He encouraged me, and that was one point of my clinical posting that that really changed me. Like from then on, I was more attentive, more always trying to read up before the postings. So the teaching can be from anyone. Like we were just talking about like a coaching, about why students are preferring coaching. We should also understand that coaching may give you knowledge for the exam, may give you knowledge for the exam, but coaching cannot give you the knowledge what you would need in practical life. And when you see a patient, that can come only from your clinical postings, which which you are doing. And one of the examples of good teaching was in our department, in the OBGY department, where if we have a batch of about 30 students, what they did was they divided the batch. One batch would go in the operation theater, one would go in the ward, one would go in the labor room. And after 1 hour, these batches of 5 students, they will come back, and the faculty there will make them present. These each 5 students from each batch, they will present what they have seen in the OT or what they have seen in the labor room. So this was more interactive, more practical. I feel the students now would be more interesting in this age. The students would be more interesting in learning the things more practically. I think that is how we should have the next level of education system, which should be more practical, there should be more audio visual, because just presenting through slides and all, as we just saw, like, it's no more. They have this marrow and they have other ways of learning. So it's always like a weighing scale where you have to understand that this is the new generation. They have access to all the knowledge. There's YouTube, there's the internet, or there's like marrow. And the teachers also need to should adapt to this new way of circumstances, new way of teaching. I think something COVID just taught us. So yes, that's it.
Thank you, sir. What you said is absolutely correct. It is very important for the teachers to work on generating interest in the students, and at the same time to adapt to both the needs of the students as well as the changing ways of acquiring knowledge. Like another one of the speakers mentioned earlier, initially it was that the teacher was the only source of knowledge available to the student. But now there are so many, in fact, there are too many other places for the student to look. It's very difficult to know if the knowledge that you're getting is valid. Maybe the role of the teacher is largely changed to the person who validates the knowledge that the student has gained from elsewhere, so that they don't get caught up in their family's WhatsApp forwards when they become practicing doctors. Ultimately, they have to have someone that they can rely on completely, that, when sir says it, it is true.
Yes.
I would like to now I'm going to invite a maximum of 4 questions. We've had the last 4 speeches. So I would invite a single question addressed to each of the speakers. Could we have a show of hands, please? Yes, Shirish. Please mention specifically
to one speaker, right?
Yes, please mention specifically
to only one speaker.
Yes, please mention specifically to whom you are addressing your question, and then continue. Thank you.
My question is to Dr. Gidesh Garekar, sir. Sir, how is the idea of implementation of teaching of ethics and humanities during posting? How would it improve the perspective of students towards postings or towards treating their patients, towards actually looking forward to them as their patients and not merely just taking their history and coming up with a case presentation? And how would it increase the quality of postings overall?
Yes, that's a good question. See, that is what I'm talking about posting. See, you learn a lot from your teacher how, like, that person is taking a history. Now you talk about ethics and humanity. See, whenever we have a patient, I always tell my residents or my students that, the most important thing you start with is the respect you give to that person, whoever is whether he's poor, whether he is rich. It starts with the respect. And depends, like, as we have many examiners here, in exam, when we are taking when we are, somebody is presenting a case, many times the history varies. Like, if some student is giving a good history, some student is not giving a good history. It also depends on how how kind you were to the patient, how concerned you sounded to the patients while you were treating with the patient, while you were taking the history. For me, like, my teacher, of course, I had very good teachers in my undergrad, but one of my best teacher in my post graduation was, I would like to mention Dr. Satish Kutty. He's an orthopedician who's in Ireland, and he had just come from UK. And I mean, he had everything you could imagine. He was FRCS ortho, he had MCH, he was great joint replacement surgeon, and that was ever I dreamt of. But the most striking thing, what I felt about him was the way how humble he was, how down to earth he was. He would come first person, he would go in the ward many times post operatively. He was the one to open the dressing and do that. Now, these are the things, simple thing this might sound, for a person, he had like 5 residents under him, anybody could have done that. But these are the things, we learn from examples. So I think this is what maybe the in-person clinical postings, you can learn more than, all those classes which you learn. I hope if that sorts your question.
Thank you, sir. I would like to invite a question from the faculty members to either or both of our student speakers who have spoken previously. Could we have a show of hands from the teachers present, please? I will once again invite a question from the faculty members to the students who have just spoken, or else we will proceed with the next question. Okay. Is there any other question from the student side? Yes, Ojas.
So my question is to Surendra sir. So he talked about one of the reasons for not approaching a teacher is that students are too focused about particular exams. Now, this is the same pool of students that go into institutes like Indian Institute of Technology. So, like, we have curiosity. So, the question is, do you think there is a lack of curiosity because of the concept that Pranav talked about, which is known as pimping, where we are shamed for not knowing something or we are scolded for asking questions? So, that translates into us not asking even curriculum questions. So how can we ask questions that are beyond that? Like maybe Pranav could also shed some light as a student in this question.
I would like to respond to this. What you said is it may not be the student's fault. As I've said, it in today's day and age, and we always compare what Vinaya madam also said is what teachers were during our time. And you can imagine teaching on blackboards, and now what we have is PowerPoint, where you have ready-made slides. You just edit or you download pictures or videos or God knows what. There you had to draw diagrams. You had to be fit back with your subject, with the knowledge. So maybe there's a fault on the teacher side also, where the PowerPoint presentation is used as a crutch, and that is what creates problems, because then there's no in-depth knowledge. So when a question is asked, the only way to show your superiority is to rebuke the student. Okay, to
Mhm.
pass snide comments or to pass sarcastic comments or to say that it is not there in your syllabus. And this might be the reason from the teacher side. Plus, the thing is that teachers nowadays are less interested maybe in teaching for the simple reason the teacher student ratio maybe 30 years back for each department used to be around 1 is to 10. Now you've got a teacher student ratio where in each department it is 1 is to 30, 1 is to 35 in newly started medical colleges. And half the faculty is not even postgraduate. They are demonstrators or tutors or junior residents or whatever. The second thing is, and this will be especially true over the next 6 months to a year, the clinical side, the teachers are so involved in patient care, they don't have the time for students. So if the student is going to ask a question and it's going to be a little difficult for the teacher to get answer that question, he's going to always rebuke. As it is, he's going to be irritable or angry looking at taking care of so many patients. And Gadekar sir might agree with me here that because they have to be, I mean, patient care is taking more importance over education of students, that the medical education is getting neglected. And I think it is the time where MC or NMC, and I think this my question or suggestion to both Supesar and all the other participants is that there is time has come where MC or NMC has to, NMC as it is now, has to think about segregating especially the clinical teachers into those who are taking care of patients, patient care, and those who are going to act, so those will be consultants in the same government hospital, and those who are going to act as faculty for medical education. I think time has come to segregate the faculty. Thank you.
Yes. Thank you,
Thank you,
sir.
sir. I would like to now invite Dr. Supe, sir. Sir has a
Sure.
question for us.
No, I don't have a question. I was having two comments to you.
Yes,
One
sir.
is, I think we are saying that we are afraid to ask questions to teachers. I think it's a very sad state. We should not really have it any time like that. I understand there could be some teachers who really say you back, but most of the teachers, if you ask the question appropriately at the time when there is not much of emergency, they will try to answer you. And in fact, a flipped classroom is a wonderful technique which all of us should really follow. That means we should begin from where students know. Never try to inject that PowerPoint into students. So if the students know at that particular level and you're taking him further, the curiosity will always be there. If you're trying to teach the same thing he knows, there will be no curiosity. So it's a question of how to find out what he is really not knowing and then induce kind of curiosity is one of the most important aspects. And the second point, you all talking about teacher shortage. I understand the teacher ratios have changed, but whether it's MCI or NMC, there is a clause for adjunct teachership. All medical colleges should have now adjunct teachers for every level. We don't have to really depend on 3 or 4 teachers in every department. We can take a lot of clinicians who can come. This was existent in KM hospital, in anatomy, physiology, in pathology, pharmacology. There used to be practicing clinicians and practicing general practitioners used to come and teach us when I was a student. I think they were the best people to teach us many things, which I think so. There could be different ways of increasing the student teacher kind of ratios and implement. We can really talk about it much more in the discussion. Thank you so much, Arnav.
Thank you, sir. Uh, for the remaining three speeches, we'll be following a slightly different format. We'll have the next student speech by Mitali, followed by an introduction on the new curriculum by Shirish, and the final speech from the faculty point of view will be by Supe sir. With that, I'd like to invite Mitali to take the floor and continue with her speech.
Hello, am I audible? Yeah. A very good evening to everyone on the panel and to those watching as well. Now, the topic that I had was the normalization of an unhealthy student-teacher relationship. So now unhealthy implies that either there's an excessively critical teacher or there's a prejudiced or maybe even a disrespectful student. Now, while these relationships do exist, I think they and also the healthy kind, they are the exceptions rather than the norm. I think what we've now come to normalize is the absence of any relationship whatsoever. I think both parties, at least most of them, are now becoming increasingly accustomed up- are becoming increasingly accustomed with making no effort to extend the interaction beyond an occasional 1 hour lecture. So I believe that there are both real problems as well as certain biases that come in the way of this. And I think we've discussed a lot of them already, but the one bias that I would like to talk about here is the one from teacher side, where I think they believe that students are now increasingly concerned with exam oriented information and that we might not be interested in anything else that they might have to say. So I think we all know that the coaching classes give us enough kgs of information and our textbooks do the rest of the job. So I think it actually frees our college professors to do for us what no one else can. So we've discussed about the didactic method of lectures before. So to all the students here, I just want you to imagine a lecture on, say, rheumatic heart disease. So on the one hand, we have a lecture with our trusted PPT and a lecturer meticulously reading off of it. And on the other hand, like Dr. Surendra said, a professor just walks in without any device and starts talking about a personal experience that he's had with the disease. Now, to all of you, which one would be your preference? Well, I know for a fact mine would be the latter. And now, to begin with, in this scenario, first of all, I would be automatically engaged. That wouldn't be a problem. Another thing that this does, and I think which is slightly more important here, is that when the second professor starts talking about his personal experience, I get a slice of the kind of person he is, right? I mean, that is what we saw with our school teachers. They would talk to us about a lot more than just our academics. And once that happens, I think maybe I get inspired by him, maybe I begin to respect him a lot more, maybe I start growing fonder of him, and then I go ahead and want to actively reach out to him. And this would then be the beginning of probably a really fulfilling student teacher relationship. And also, I think it's a win-win. We would save all our teachers from the harrowing task of preparing a PPT. So yeah, I think the bias that teachers have, that we're increasingly concerned with only information and data points, I think they're a little misguided in that, if I may say so. Thank you.
Thank you, Mitali. That was a very powerful and pointed presentation, if you would permit my wordplay. You really highlighted very useful points that sometimes we just get stuck in the pattern of things that are going on. जो चलना है वो चलने दो. And neither side wants to take a little extra effort to improve things and take them one step further. The other thing which you really highlighted is that when people share their personal experiences with us, we relate to them as a person as well as to the knowledge that they're sharing. And at the same time, listening to a clinical scenario as a story sometimes is the story that stays with you more than the data that was shared. And even when you sit for your entrance exam and you see a case scenario, what you will remember is, Arey, that is what I heard in the lecture and sir had told me a story about it. So you never know which memory triggers where. In fact, that is one of the memory tricks, remembering data as a story. So when that is the presentation and the form of teaching, it is definitely more helpful for the students. Thank you for that, Mitali. With that, I would like to invite Shirish for the next speech.
Thank you, Arnav sir. Am I clearly audible? Okay. So the implementation of the new curriculum has actually been revolutionized the way we are perceiving medical education. The implementation of the topics like early clinical exposure, the foundation course, the mentorship program, the student doctor based clinical approach of teaching, and of course, the way more focus has been given to the small group discussions. But so these give a lot of promise to what we have been discussing right now, as well as shaping the clinician as a whole. But the point here remains key, whatever has been proposed, how effectively is it being implemented, or how effectively are the faculties implementing that in the college? So, with all due respect to and appreciation to the efforts put in by the faculty members, I would like to represent the opinion of 107 first year and undergraduate medical students of our own college who had participated in my survey on how they perceive the current curricula. Starting off with the mentorship program, students say that mentors are very approachable when it comes to academic discussions or solving their academic problems, but 62% of the students feel that they are not approachable, or they don't feel like going to them for addressing their psychological issues. So maybe the point what Arnav sir mentioned about the about the PG mentoring program could be implemented here in a better way. Then again, while students are highly appreciating how early clinical exposure, introduction to ethics and humanities, and regular practicals are being conducted, they are not finding sessions on technological skills, language skills, communication skills, and the way the lectures are being taught about community medicine, as well as how they are teaching humanities to the students effective enough. This was significant by comparing. Actually, I took it on a larger scale, which was a 5-pointer scale, and scores of all this perceived effectiveness of all these was below 3. So talking more upon that, more than 60% of the students believe that the interest of the subject or the topic is built up by the way the professor is teaching the topic, or the way the professor builds the enthusiasm about the topic. But the students are highly dissatisfied with how still the regular lectures are being conducted, with more than 66% of them preferring to do self-study rather than attending lectures. Then they say lectures are still monotonous, like more than 50% agree that most of the lectures are still monotonous. They say there are too much of focus on factual information, and they say we are expected to remember just too many facts, which may not help us as a clinician in a later run. and also 45% of them are saying that they are not even understanding the rationale of what they are being taught. uh, Apart from that, the pattern of integrated teaching actually hasn't helped a lot, which was evident by there was no significant difference in the scores of regular teaching as well as integrated teaching. Students perceived at effectiveness of the both as same. The other thing that I would like to mention about is this complaint of students regarding introduction of more journals. They are saying the problem is not with the journals, but the problem is of blank journals. That is decreasing the interest of the student in that subject even more. And not to say almost 100% of the students voted against the entire that was introduced in the foundation course of any use. Then one of the most important point that has been highlighted in the new curriculum is the role of leadership and organizing skills a student and a clinician must have as a competent clinician. So how is this leadership and organizing skills going to be implemented in the students? More than 50% of the students feel that there is no room for organizing or participating in extracurricular activities throughout their curriculum. And these things have been proven to be effective in implementing these qualities in the clinicians. So how do the entire panel try to tackle on that? As well as I would like to give a brief solution regarding the teaching program. Uh, Almost 60 to 7, almost 80% of the students preferred having small group discussions rather than lectures. And regarding the small group discussions as well, there are articles which and studies have been done which say that even in the small group discussions which are divided based on the roll numbers, the enthusiasm of different students, the intellect of different students make the other students shadowed, which actually doesn't help with the entire discussion as a whole. So what could be done here is there could be a aptitude test at the start of the curriculum which could assess not only their intellect but their enthusiasm, their ethical morals, and whatever competencies that they are looking for in a clinicians. This would not only help uh, give a better discussion in that small group discussion, but would also help the students who are actually in need of teaching, the ones who are actually feeling left out even in the small group discussion and are feared to ask their doubts. So that is one of the thing. And the other thing that I wanted to mention is about the way students are perceiving ethics and humanities. They are students trust more their peers than their teachers currently, how the dynamics are going on, and that's why maybe we are having this talk as well. So maybe if we can introduce the teaching of ethics and humanities through peer based discussions rather than a full house lectures, those would give a better insights to the students. Like a student who has already understood its importance, taking a small group discussion among his peers would have a better impact on a student's understanding of that topic rather than a teacher teaching it. As well as the most effective solution which the student pointed out with for this, what I asked कि how could this be implemented in the clinical posting? They say कि हम doctors को देखते ही नहीं है करते हुए. We are saying they are too busy with the thing कि काफी कम doctors ये करते हैं. So why do we need to do that? So that is the one question that they had asked. So all over, I would like to end my talk कि if everything has been planned, how effectively could it be implemented is the question. Even Supesh sir had mentioned it about the article ki how teacher training program has been done to implement this curriculum. But are all the teachers actually following it? Are all the teachers actually enthusiastic to bring about a change? Is the thing that I want to end with. Thank you so much.
Thank you, Shirish. We can see that you have really taken a lot of effort so that the voices of the students can be heard by everyone, and that is a really commendable effort. If we have more such studies which help make the student feedback reach the teachers, that would be most important. There is a saying that the speech of kings and the chirping of birds should be given equal importance. That is the only time that you will achieve a uniform system and there will be peace everywhere. Before I invite Dr. Avinash Supe sir to speak next, I would like to just mention something from my personal experience. Among the teachers present here, sir is the only teacher that I have personally interacted with, and I have interacted with him as an undergraduate student as well as a medical resident. And sir was the dean of KEM Hospital at that time. And what we really experience is, sir has honestly been an ideal teacher to all of us, both inside and outside the classroom. And as somebody mentioned in their speeches, it is the simplest of things. If sir used to see students in the corridor and somebody said hello to him, sir would stop and shake hands with that person. Even now, when sir addresses us, he addresses us by name and he addresses us as if we are almost his equals, whereas actually there are years and years. I mean, the gap in our experience is not something that we can even articulate, forget cross. That shows you what a teacher should be. With that, I would like to invite Supe sir to please express his views.
Sure. Thank you, Arnab, for the generous introduction. I think thank you so much. I really learned a lot of things from all of you, but I'm going to summarize one simple thing that yes, is the relationship between teacher and student spoiled, or it is unhealthy, or it is not the way it should be? I'm sure that is what has happened over last few years. And there are many other three basic issues which are there. The issue is with teachers, something that many times they are not available for students at time when they need it. Second is there is a poor motivation for teachers to really teach for various reasons. They are maybe more interested in practice than the teaching or clinical work. Third is they are not interested, and sometimes their competence may be issue. They may not be ready to use newer methods, or they are worried that people will ask too many questions and I'll get exposed. From student side, there's a mixture from all over with no allegiance, but coaching classes is the main problem. NEET, as somebody rightly said, the whole purpose of learning in medical college is different than whether you are learning clinical skills. Competing interest of students, then person and hostel issues, food hassles. Sometimes a person comes and stays in a campus, he has to get adjusted. These are basic issues. Somebody needs to also understand that. And lastly, I think culture issues. There are different kind of cultures which exist in an institution. I mean, whether it's academic, whether it's an area which you are coming, rural, caste, there are so many cultures which parallelly run in an institution. Values are changing. There's a available information online. Students don't want that information. Students want what is called as a wisdom. There's a information to knowledge to wisdom. Students are looking for wisdom. They're not looking for information. Teachers must change it to give to that wisdom to them. So what does it resulting? It resulting into what is called as a hyposchilia. It's a syndrome that the new students which are coming out, they are good in knowledge, good in MCQs, but very poor in clinical skills, attitudes, and communication. And that's the problem all of us are facing. It's not Indian problem. This is not KEM problem. This is a global problem. There are papers on this. So we need to change. We need to improve. Definitely we need to improve on this. And we have to attack all three. It's not that one person needs to be attacked. Teachers, students, and cultures. It's not the one thing will really change. You have to motivate teachers. We have to really bring them. I think rightly you said approachability. Relationship between students and teachers don't happen into crowded classrooms. They happen outside. They happens during the grapevining. They happens during the talk outside the classrooms, on kattas, on treks, hikes, picnics, or during cultural festivals. That's the time you start understanding students and their needs. When you're teaching to 250 students, you never understand a student. You may be able to identify 2 or 3 students, but 250 students, it's very difficult to do it. But at the end of 4.5 to 5 years, you should be able to know that student, how it is. But that is not happening today. So there has to be mentoring programs. As you say, the effectivity has to be there. Or there could be many things which I think in an institute are built in. Fortunately, I must tell you, in KEM Hospital, there are so many inbuilt small things which bring teachers, students together. And at least during our time, it was there. Maybe in last 10 years, I've seen it receding, but there are still good students and there are good programs. I have seen really good students as is a dean also. So I personally feel we need to really find out how to become close to the teachers. Sometimes teacher may get angry on you. Doesn't matter. It's ultimately phases of life. But ultimately a student should be loved by teachers and teachers should love students. Then only we'll find the relationship will improve. Now, if you really see all these problems, we try to really discuss this in the curriculum. Somebody talked about curriculum, questions. You have taken 107 students. We have about 13, 14, many papers on this. There are so many feedbacks have come all over the India, world on our curriculum. But what is the crux of this curriculum? The crux of the curriculum is that we want to make it competency based, but we want to cut down the didactic lectures to 1/3. We don't want students to go through didactic lectures. No nonsense PowerPoint lectures. Start with flipped classrooms. More of discussions and built on what is students' knowledge. Secondly, more emphasis on attitude, ethics, and communication. Now, somebody said, how do you build in that? Bring it through narratives. Bring it through peer discussions. Bring it through self-directed discussions. We learn much more in a campus rather than a didactic lecture. Ethics is usually seen by looking at each other, looking at your teachers, peers. Same thing is with the communication. All of us have come from vernacular medium. But our institute really taught us how to do public speaking, how to stand in front of 1,000 people and speak. All this is to be done in our own institution. And secondly, there are a lot of new elements. I think I was very happy somebody said early clinical exposure. See, teachers have been taught, more than 50,000 teachers have been gone into this program, but it would take 10 years before they get really proficient and the time becomes really, the effects of these kind of curriculum seen after 10 years. Curricular change is a lifelong process. So the effect of such kind of a seed will be seen after 8 to 10 years. They will not be seen immediately or at the first year, or maybe there are some experiences, narratives which will come. And of course, journals and rigidness of the system is by your local teachers. The new curriculum or new NMC is quite flexible. Ultimately, the universities and colleges make it rigid. So depending upon how your teachers are, you can make it rigid or flexible. So if you really see, the building up of a student and teacher relationship is not only one way thing, both of them have to put one step forward. Like say Dr. Kothari and Dr. Lopa Mehta, we could enter their office anytime and ask them any question which is silly. And they would answer us with the same amount of love, and this is a lifelong relationship, all our teachers. We took surgeries because my teachers were good, Dr. Samsi and Dr. Bapat. And as you rightly said, many times we are influenced by our teachers for our careers. But ultimately, our students-teacher relationship, they're outside the classrooms. No, I can tell you for the last 44 years, I have every batch of my students, 30 or 40 year students we taught, are still in contact with us. We still meet, we still go out, we have still understanding of each other, and they are more of a friends now rather than student-teacher. I think that's what made them learn, and all my residents made me learn. So it's a both ways. We also learn a lot from students' questions. If students ask a silly question, it also makes a teacher think. So there are a lot of things which we need to change. Okay, will it change? Will students really change? Yes, there is a way. Where did we go wrong? We went wrong by introducing one single high-stake exam like NEET or kind of exam, which directed the whole student's direction towards MCQs. So if you want to change, we have to change from that particular system. We have to bring questions of clinical wisdom and clinical MCQs into that next. If NMC is going to do it, we are trying to bring questions where the clinical experience and clinical wisdom is necessary. So if you bring that high-stake exam close to the clinical wisdom, all this will change. And that is what is needed to be done. Maybe student and teachers' personalities will have important here, but ultimately we built ourselves because of the relationship. We should not underestimate it. Don't make teachers or students as enemies. They are our lifelong friends, colleagues. They're the people who will support you. People will help you. And those are the people who will give you satisfaction. So I think we should take it in a very different way, this student-teacher relationship, rather than just as a giver and taker, because it's both ways rather than one way. I think that is what I would like to say about this. If there are any specific questions about curriculum or any teachers, I would definitely like to take them.
Thank you very much, sir. That just shows us how sir's years of experience, where sir has been a teacher to many of our teachers. It shows in every point that sir spoke. He reached right till the hostel rooms and right to the food that the students were eating. And that is how we understand that we get closer to our teachers, because the teacher knows you right from the beginning. The teacher doesn't know you just in the classroom. They know you for who you are, not just as one roll number out of 180 or now 250 to update my knowledge. Thank you very much for that, sir. So actually, there's a slightly different question for you. This is from one of our YouTube live viewers.
Ask me.
They want to ask you, sir, that when in a classroom you have students of various levels, each of whom has a very different understanding of the subject. So what was your approach to making the lecture more inclusive,
Fine.
including
So
all those types of students into that?
I think so. A very nice question. Thank you so much for asking. You know, in a batch of say 30 students, I'm not talking about 180, but I'm talking about the 30 students which come for your clinic. You always find some students who are over enthusiastic. They would answer all the questions, they read about it. I think we just need to ignore them and solve their only queries. We have to help students who are in the main front. You have to just follow your curriculum with that. But at the same time, look for some students who are not doing well, who are keeping quiet. And after the round or something like that, quietly talk to them. Ask them what is their difficulty. And if somebody asks them a question specifically, probe them. If they're not able to answer, don't humiliate them. Many of them, they are closed. And I've seen so many of my students, if you talk to them outside, they will come out. I've helped them to grow up. Sometimes I've taken special classes for them. I've tried to explain them specifically. So you have to look for those slow learners. You have to look for those shy things. And that's way, because otherwise, you know, in a KEM where there are 180 students who are all gold medalists and toppers, you know, sometimes there are some students get lost. So we have to be very careful about these slow learners. And I have been always trying to watch in my class who are slow learners. And I would like to really take a special effort for them, but not in front of everybody. It's outside the room. Talk to them, ask them any difficulty, and then you would probably help them. That's the way you should look them. And I find those students have good potential. Sometimes they have only language issues or communication issues. You work on them, they would do much better than many of the toppers also.
Thank you very much for that beautiful insight, sir. With this, we'll continue with our open panel discussion. We have the next question from Dr. Amaya.
Sir, that was a wonderful talk. So just along that line, my question is twofold. One
Dr.
is,
Amaya, sorry to interrupt you. Please specify the name of the person to whom you're addressing the question.
Okay, I was.
The audience is also aware of that. Yeah.
Okay, I'm sorry. I was directing it to Dr. Supe. Yeah.
Sorry, I'll just re-clarify that we are in the open panel discussion now. We can address questions to other members also. Please continue.
Sir, so do you think that when there is a claim that there has been a new format of teaching that has been unveiled, sometimes do you think it's just a change of terminology and not a real change? Just to cite an example, you know, what exams have existed after postings ever since, you know, perhaps, 50 to 60 years ago. And today it's just given a fancier term called as continuous comprehensive evaluation. So while there are some changes, do you think a lot of the changes are just a redoing of nomenclature? And the second part of my question, sir, is do you think there can be something done with the system to encourage more innovation? Would you have certain suggestions in mind with regards to that?
Thank you so much. See, whenever you are making a curricular change, it never happens suddenly. It's not something drastically it was doing before I suddenly changed it. Curriculum change always occurs at borders, you know, at the blink of borders. That's where it occurs. With considering our 600 colleges, with almost about 1 lakh teachers and 1 lakh students, you know, that is what our income capacity today is 80,000. That means we have 4 lakh students, 1 lakh teachers, and we have so many colleges. Now, when you think about a change like this, it's not only re-terminology. You know, many of the elements have been put here is very well. If you see we have published now 11 booklets. You should see those booklets. And we have tried to do this and take to the teachers that yes, there is a need for change. So in India, what has happened, definitely people are now shifting from the didactic lectures to small group teaching. Sometimes, they are doing it, discussions. There are a lot of intelligent teachers who are, but universities have to change for these comprehensive exams and the internal assessments. But these things will happening, they will change over a period of time, because ultimately formative exams, your online and day-to-day exams and your weekly exams are going to see how you're going to, you should not be worried about them, because they are small 10 minutes exams, 15 minutes exam, but they will probably make you change, rather than one summative exam where you pass or fail by crook or hook. So I think it's a continuous development. So these are not re-terminologies, these are concepts which have been pushed, but it will take some time for teachers to adopt it and apply it. There's a little rigidity in faculty. The students are ready to change. Faculty is little rigid. The problem is with faculty, it's not with students. Many times, I think we should really make it very clear that teachers have to learn. Like, for example, online learning, online teaching. It's many times I find senior teachers have struggled to go on Zoom or meeting. They would find problems with their agreeing. Young students change everything, they are immediately. So I think it's a question of time. Over a period of time, people will realize the value of this, the culture will change. It will take time, about 5-7 years. So they're not re-terminologies, they're newer concepts.
Thank you, sir. Sir raised a very valid point that very often we have an inertia to change. Though change, that is what hinders a lot of the progress that we would have made otherwise. So with time, we hope these things will improve. I'd like to invite the next question from Dr. Vinaya Shah, ma'am. Ma'am, could you please unmute the microphone?
Here we are definitely trying to make change. I agree with Dr. Supesar and the question put by Dr. Name, sorry. Yeah. So here now I was a part of formulating some objectives in pathology, because now the new batch of 2019 will come in 20. So there was a national webinar where we used to meet twice in a week for formulating the specific objectives. And the members, all of them were all HODs of South India, in North India, all of them very, very stalwart doctors along with them. And I was the only person from Maharashtra being part of it, where we completed all the SLOs, but there we were trying to see this concept, because we were all senior teachers, how to teach them. So we have developed a lot of cases related to each and every topic of the general pathology competencies and systemic pathology competencies. And it was an amazing experience which we had. And just 2 weeks ago, we finished all those SLOs. And because I was only representing from Maharashtra, I wanted, because to maintain this homogeneity of these SLOs, I just 2-3 days ago, I shared all my SLOs of 36 competencies in pathology with all my pathology HOD colleagues of Nair KM Sign, and also shared it with all the other private medical colleges, because there also our students go there. And that is the definite change which is happening. Definitely, we are trying to, because really we can understand how that student will understand this concept, especially molecular basis of neoplasia. That is too dry a topic. How to make it more interesting? We are really doing that, and that has been my topic. So definitely the change will come. And as Dr. Supesar very rightly said, the changes to be seen will definitely take 8 to 10 years, because all this standard, this program of outcome based is, derived from a lot of international experience, and big stalwarts like sir and others have done this. So definitely the changes will take long time. And to compare it, as sir said, it's very early to judge. And I want to tell the students, like first MBBS, second, about journal. Now that aspect is also not there. Now there is something called logbook. So where another is reflection writing and narrative. Now reflection is a powerful tool to write your learning experiences. In fact, there's a technique also of reflecting writing, reflective writing, that has to be first initially taught to the students. That's how you have to, these are the format to write. And what happens, whatever day it happens, in the morning to evening, whatever you have learned, it could be a simple experience, it could be also simple your own personal experience with your teacher, bad or good or whatever, that you can start writing in your separate reflection book. We maintain it from the day one, and you'll be surprised at the end of the year or the end of your professional career. You'll see what points you have learned. Sometimes it could be just aha moment of some topic you understood. Write it. That will reflect on your reflective book on that particular day. So that is a very powerful tool, which again CBME has introduced. So please take a good advantage of that. And as sir has said, slow learners, yes sir, I agree totally with you, sir. I have the students who are in supplementary, and I have gone again, I've taken the advantage of this lockdown period and separate Zoom periods I has to take, and I really started talking to them on one by one issue. And really they have lot of because they are really intelligent, sir. In fact, they have full potential, but somewhere down the line some inferiority complex comes, and they cannot mingle that. So because they, that I also experienced. So you have to go out of the way to talk to them, which have done it personally at my level, and have really and then once you start communicating, then they come out with such problems and their real issues which they cannot share with their own parents. As I said, at this level, we are an extension of the parent student relationship. So that's some part which they want to share with us, and we have to become that media so that it becomes this easy. And also one last thing, like we all have said, there was one point of because of some discrimination, the diversity of all this cultural background. Yes, it is being taken care of in our foundation course, so that there is a non-academic session where all of this can be addressed. But I just want to say to all students and sir, like this is my view on it. The diversity of the cultural background of all our students actually poses a special challenges for the teacher to be able to connect with the student. But though there is a diversity, it is a big boon. We have to look at it as a big boon in enhancing our experiences and hence overcoming some of our own teachers' biases. In fact, you must be knowing the top universities in various countries world, they reserve certain percentage of the seats to maintain this cultural diversity, so as to prepare the students for the true world citizen. So you have to take it as a uh, like a challenge. Yes, you are going to encounter such people, so take it as a challenge. But if you actually go down to the deep down to the cultural diversity, you will find an underlying homogeneity of the human nature. There is a homogeneity of all the human nature. You will finally realize that that is the wisdom which you will get. But you have to start interacting. The diversity is the only binding factor, and that India is anyway famous for it, our country. So yes, we have to. I mean, sorry, sir. I mean, I don't know. I just
No,
went
no.
with the flow.
Vinaya, what you said is very right. I think
I
we have to have cross-cultural diversity, how to
Yes,
cope
sir. It
with
is a
that,
must. Yes.
and how to really accept. First start
Yeah.
respecting cross-cultural diversity,
Yes. Yes, sir.
and then try to cope up. With all
Yes,
that
sir.
what we are doing, not only as a teacher but as my
Yeah.
colleague,
Yes,
peers.
sir. Yes,
And
sir.
if you are
Yes.
able to instill that in our students,
Yes,
I
sir.
think that will bring a better atmosphere
Yes,
into the
sir. Yes,
college.
sir. Definitely, sir. Definitely. Because knowledge is available everywhere. Now our role is definitely dynamically changing. Now we have to be there to them to so that they have a lot of information. As teachers, we are facilitators, guide. Also, we have to help them from irrelevant information, which is a relevant information,
True.
and many other such things. Yes, because
Last, I would like to say one point,
yes, sir.
that after 30 years,
Yes, sir.
we don't remember what my teacher has taught,
Yes, sir.
but I remember how he treated me, how
Yes,
he
sir.
behaved with me.
Yes, sir.
So I think everybody should take a lesson that if I want to be a good teacher,
Yes, sir.
I should treat my students well. I should
Yes.
treat them like not only with respect, but also with dignity,
Yes,
and
sir.
they will remember you for life. I think
Yes,
that's
sir.
the beginning of your student teacher relationship, and then you grow over it with knowledge and wisdom. I
Yes,
think
sir.
that's what is the solution for this changing your whole student relationship.
Thank you, sir. Thank you,
Yes, sir.
ma'am.
Yes, sir.
We get a really beautiful perspective from both the senior teachers that wherever all of us have been raising these points as problems, they have been raising these points as solutions. Wherever we see an adversity, they see an opportunity to bring something new to their teaching, to bring something new to their students. And that's really something that we need to learn from. They are able to see, like, for example, where everybody said that diversity is a problem, they are seeing it as an opportunity to reach out to more people. So it's a simple change in our perspective, even as students, that makes so much of a difference. And if what we can imbibe from them, what they have gained after so many years of teaching, it would really help us even in our student life. With that, I would like to invite a question from Pranav.
Yeah, thank you so much. I would like to, more than a question, I would like to comment that
Pranav, I'm
there,
sorry to interrupt you, but
okay,
I would prefer if
okay,
you
fine,
at
okay,
least
fine.
address your comment to a specific speaker so that we can keep the discussion
Yeah, my
a
question
little limited.
would be basically to Dr. Supe sir. So while in the discussion, there was a point on why students do not attend clinical postings, and my problem is that there is, like, when it started, like in fourth or fifth semester, there used to be a temporal incoordination between the theoretical and practical facts, and that's where the mastery of content for students actually matters. And well, I'm not sure like how the colleges are covering it, but students are getting it through coaching classes, and especially platforms like Marrow and PrepLadder, which are actually giving online recorded lectures which students can consume at their own pace. So is this pattern feasible at an institutional level where, like, interested teachers, like, who have better enthusiasm in teaching, plus who are proficient in communication skills, like just as Shivarkar sir had earlier said, that we have to segregate faculty who practices and who teaches. So is it possible, can we create such cadre of teachers and then provide an platform for learners to access these lectures, like,
Yeah, I
online?
think I think if you really see, Pranay, in America there are three streams of teachers. I mean, three streams of hospital people. One who are purely clinicians,
Yes.
some are clinical teachers, there are some clinical researchers. You know, that means 80% is clinical, 20% is teaching. Some are 80% teachers, some are 20% clinical, and their pays come like that. In our place, it is not like that. Our place, the teacher is a clinician, teacher, researcher, administrator. He is also in a COVID duty worker and everything, you know. So that's a problem. So if you really see the, if somebody is working in a particular case, I think go deep into that phase. Sometimes it may be a learning which may not be with the flow. It may be outside the flow. But I still remember my first case of a prostate, which I assisted for operation as an undergraduate student. That prostate at that time read so much about prostate. Now that is fixed in my mind. So when you have a case like this, that's the time you go and ask all questions, assist your teacher, assist your teacher. You will learn much more rather than trying to say, okay, let me have the same time lecture. That will never happen.
Yes.
The knowledge, because patients are not fixed. You know, you could
Yes.
have some fixed, but you have to learn little out of the box, go beyond what your classrooms are there to solve your curiosity. Then only you will learn more. And this is the time when teachers can help you actually.
Uh, just to add, can we have some clinical modules in which, like, basic, you can know, like, standard cases can be discussed, and before approaching these cases, students can actually view these to get an insight at what they will be actually viewing at.
Enough available on the websites.
Yeah.
There are enough available on the books. I can give you so many
Yes.
textbooks and videos, and I think that is not a problem at all today. You know, the question is somebody taking your hand and showing you, okay, this is
Yes.
hard, this is soft, this is this sign. I think that
Yes.
where the bonding comes, you know.
Yes.
You know, that is what is more important. Otherwise, videos are many, you know, that is, I think there is no issues about those videos today, as so many sites. And actually, if you see, our internet libraries are so good. Actually, there are enough material, there are enough ways of finding it out. I think every class has 4 or 5 students who has a library of books. I don't think, but most of the people will collect it on a pen drive or on their computer and never read it. That's my problem.
Can teachers serve as facilitators here? Like, can they guide students on how to approach these internet libraries, like how to access content through these internet libraries?
Absolutely, that should be the first lecture in a foundation course. I think it's not the how to acquire knowledge, how to use that knowledge, information properly at right time, how to acquire it. That's the first lesson. You know, when I did my masters in American universities or everywhere, we had 1 day course on library, how to access libraries, how to be understand these libraries, you know, not only physically but internet wise, how to search, how to get knowledge. In fact, there are ways of getting an article by which you don't know, you don't have to pay. All these tricks, I'm sure as a student we all learn.
Thank you, sir. Thank you, Pranav. We have a question here from YouTube, which was addressed to Mitali. Uh, we have a viewer asking whether you would like to clarify whether the fact that the newer batches joining in seem to be losing interest in lectures, is that sort of attributable to their seniors and the influence that the senior students have over the juniors? Is it that the attitude of the seniors is carrying forward to the juniors? What are your views on this, and would you like to mention something?
Yeah, so this was a subtopic under my topic. But when I thought about it, at least from my personal experience and from what I've seen in college, I don't really think that the senior batch's relationship with teachers has a lot of bearing on what my batch will be like with our teachers. So I don't think there's a trickle down effect. The only correlation that there could be is possibly that if there is a lot of prejudice about a certain teacher that is passed down from a senior batch, then the junior batch, without even questioning it, might just be very wary of that teacher without even trying to approach them in person. So that's my view on it.
There's something that I would like to add here personally, and that is even among student groups, there tend to be seniors that you're closer to and people who you tend to stay away from. A lot of that clustering, personally from experience, I would say revolves around the extracurricular activities that you participate in rather than your curricular interests. So, those that do the debates and public speaking tend to stick together. You have a lot of people who are really close in their football teams, like Sir mentioned hiking. So, that is another thing that carries forward. And would any other student like to mention this? Whether, without giving names, please, would you like to mention if any of your seniors have ever influenced your perspective towards your teachers, even as a group or even as an individual? Yes, Shirish.
Yes.
Yes. I would like to mention about it. So there is a lot of prejudice about this, especially with regard to what postings to attend and what not, what teachers to listen to about what not. The thing is, they say अगर तू ये सब कर रहा है, तेरे को ये subject का posting attend करने का जरूरत नहीं है. They don't teach anything. So this becomes a vicious cycle. The thing is, the senior tells this to junior, he doesn't go. If the faculty member is in a fresh mind, ki at least this year I will teach something new, I will build up it, and students don't turn up, then again there is a vicious cycle coming up ki nahi abhi wapas students nahi aa rahe, I am losing my interest. And then finally a student decides ki okay, let's go. Then again there is no faculty there to teach, or there is not a systematic plan to teach. So then again there is a lot of interest from the student, and then he starts believing ki nahi yaar senior sahi bol rahe the. So this thing has to be very rationally explained to the students, and teachers need not tell कि अपने seniors का मत सुनो. They need to tell them how to judge the judgment of suggestions given by the seniors, what to listen to and what not to. It's all about, you need not tell them कि what you need to listen, what you not, what you need to think about and what not. It's about how to do it and how to do it.
Thank you very much, Shirish. Since we have the students' perspective on this issue, on how seniors influence the opinions of the juniors, I'd like to invite some of the teachers to give their side of the story.
Can I speak?
Yes, sir, sure, please.
I would like to add to this. The thing here is the influence of seniors over juniors is more in the hostel compared to those who are localized, those who are staying in their houses. So it's like your wife and girlfriend. Your wife is going to influence you more because you are with her 24 hours. Your girlfriend, you're going to be there barely for a few hours or whatever. So it's the hostelites who are more influenced by their seniors, and it's not just the teacher. It sometimes comes down to the subject also. You need not attend the lectures of this subject because it's given in the textbook, or it's not just limited to a teacher. It is to a subject. You attend only the practicals of this subject. You attend only the small group discussions of this subject. You attend only the didactic lectures. This is what happens. It also boils down to the unit, the residence. It's everything. So it's a big complex issue and not as simple as a single teacher involved or something. It starts right from the subject down to the teachers, down to the residents in that unit, and so on and so forth. And it is mainly due to the students who stay in the hostel who listen to their seniors rather than those who are staying in the local city. Thank you.
Thank you, sir. I want to add something here. there was a mention among the speakers that, we are told that if you're doing something, you can avoid this posting because you will save time and you can invest that time elsewhere. So I want to pose this open question to the faculty members. Do you feel that, as sir said, by adding a really high pressure exam like NEET, we have created this need for students to want to skip their postings because they're forced to invest their time elsewhere? Even if they want to be really sincere in their postings, but if they feel that their time management is not appropriate, their attendance of posting currently is not the deciding assessment. Rather, it is a completely unrelated and sometimes even trivia based or factually based exam for which they're forced to take out time. It's not that they want to take out time. Maybe a lot of them would prefer to spend that time elsewhere. So we would like the teachers' views on this, please.
Yeah, true, very true what you said. NEET is one of the biggest thing which is created by the judiciary. Actually, all these high-stake exams are created by the judiciary. Before the NEET, I personally feel somewhere in 80s and 90s, the relationship in hospitals like our college was so different. As you said, we used to learn from our peers, our seniors. I think I was, even my teachers, I mean, we used to have such a different, and after the NEET came after 2000, the whole thing changed. Slowly the classes started coming and all. So NEET is a problem that has killed this relationship, no doubt about that. But as I said, we need to bring in the clinical kind of based question, like what most of the USMLE and all they have done. So if you bring that concept, then slowly you will find that people will go back to the wards and they will understand the importance of this. Today, what has happened, if you talk to any clinical director in the US, they say Indian students are good in theory, but they are very poor in practical. They are poor in communication. That's a commonest feedback I get from all over the world. Any go to USA, Canada, everywhere they'll give that feedback. The second feedback our students feel, I want to only pass this exam and I want to go further. I want to do MD, I want to go to DM. So their input into those 3 years is very limited. Just to pass exam, get a rank and go ahead. I will work during that particular time. And there they slog. So I think this jumping has to be really avoided, where you need to create an interest. So these are the issues. So I think slowly we are working towards it, but it is taking more time than necessary because the system is too large. And we have lost the fun of the whole education in that. And let me tell you, the students don't learn in these colleges. We always learn beyond classrooms. It's an institution which builds you up, not those classic didactic lectures. They never built you up. So what you live in a KEM is something which is very different than living. Like why IITs are there? Why KEM? These are professional colleges. They are complete colleges. There is a sports, there is an event, there is a canteen, hostel, life beyond classes. That's what makes a student differently. So we need to bring back all that. Currently student spends only 2 hours in a college, then he goes for the classes. He doesn't spend enough time into college. So that's how the relationship will develop. So that's a problem today. So we need to change that NEET. NEET is the biggest problem according to me.
Thank you very much, sir. This is an important part of the perspective, that we understand what is causing the gap. That is the only way that we can bridge the gap. I would like to, I'm getting a hand raised from Akash Sethi. Akash, do you have a question for any of the faculty members?
I think I've asked one, so I'll pass on to maybe Amay sir or Ojas or anyone who hasn't asked till now.
Is there anybody who would like to add an additional question?
May I?
I think Ojas had a question. Arnav sir?
Yeah, sure.
So I would like to ask a question which is centered around the concept of NEET. So NEET is currently a high stake examination which we tend to focus in. Now what we have seen with Next is those same commercial institutes are now prying on even students younger than us. Like we have seen a rapid transition on the years that we join coaching classes. Like before we came, it was mostly final year and internships. Then our senior batch joined it in second first. We joined it in third minor. Now, because of Next, people are even asking me if they should join coaching classes from first year. Like, so how
11th
is
standard? I think that is the Next.
yes.
No, no, no. I think it's a commercialization totally, making money. I don't think it's a question of how you are going to do that. In fact, if you see our 2000 Vision 2015 report, I don't know, I was on the one very high stake committee at the national level. So we said that we had actually proposed to the government, which government did not agree. What we had said that instead of one exam, you create 3 or 4 exams,
Yes.
at the first MBA, like USMLE 1, 2, 3, 4,
Yes.
and
Yes.
you take a combined score and
Yes.
take percentile score, and that would probably help students like first MBBS and first MBBS, second MBBS. So
Yes.
then students will have that area much more concentrated, and
Yes.
you bring a clinical skill exam also in that, which is what is that next is working. But
Yes.
in India, the numbers are very high. If you see, USA have only 17,000 postgraduate
Hmm.
teachers and
Yes.
student. I mean, students, and we have 80,000. And how do we really put our that standardized patients, teachers, clinical skills, bring standards, because there'll be so many court cases. So that's our issue.
Hmm.
So we have to find out solutions for this. And I think
Okay.
maybe new NMC will find out this next issue in next 5 years. But till that
Okay.
time, this chaos is going to go on with NEET.
Sir, would adding the part of extracurricular activities like USMLE considers a lot of involvement in social and research projects, would that benefit students in India?
Definitely, I think if you can do that, when I was appearing for postgraduate seat, we used to get 4 marks per certificate for doing extracurricular
Oh,
activities. But
okay.
then students had their own innovative ways of doing it. See,
Hmm.
I remember one student who put a dabba and tried to take part into the swimming competition because there were not many candidates, and he got 4 marks. So I think people try different methods of doing it. So they see, once you bring in that, yes, so it should be okay. Those who are working at a national level or state
Hmm.
level, I'm sure they should be
Yes.
given those marks. Fair enough. I think it's worth giving that kind of an thing, extracurricular, or especially you say somebody talked about projects. I
Yes.
think we have introduced this electives,
Yes.
and all these ICMR fellowships and research. So trying to bring research component is very important. But
Yes.
I think there are wonderful, about 15% of my students had almost publications before they did internship.
Yes.
I think that's good, but then everybody is
Yes.
not in a condition to do it. But those who want to do
Hmm.
it, there has to be an opportunity.
Yes. Thank
Everybody
you, sir.
doesn't have to do it, but they can do it, some of them.
I would like to just cross question this, and the floor is open to the answer. If we make extracurricular activities, and here I'm not talking only about research and social activities, but for supposing we say writing poetry or playing music, what if we include that in our entrance exam syllabus? Will we sort of be taking away the beauty of those activities as well? I would really like to hear everyone's opinions on this. And I have another question which has come in from YouTube. It is that the senior most professors have a very limited interaction with UG students. And here I'll structure the question a bit. When we used to join that second, first MBBS, we used to have absolutely no clue of what is being spoken around us. So they used to say, "Abhi ye mat karo, tumhe samajh mein nahi aayega." By the time you reach final MBBS, it is, "अरे तुम्हें ये भी नहीं पता, तुम final year में हो." Somewhere in that transition is what we're missing out. So I'd really like to invite answers from students and teachers, particularly the teachers, to both these questions. Thank you.
I would need to volunteer here some information, as Professor has been time and again saying that the large numbers, our population is a problem, all said and done. Because in Western countries, you consider US, Canada, Australia, whatever, the first thing to get admission into a medical college is your aptitude. So there are multiple levels of interviews and not just your marks in the UG NEET or PG NEET. And what we are doing here is your marks in UG NEET and PG NEET are considered for admission to medical college or postgraduate courses. But once the students enter, then they realize, some students, I'm not saying all of them, some students realize that they have come into the wrong profession. And that is what creates a problem. So, yeah, what is the problem in India? And we cannot, it is very difficult. I'm not saying we cannot solve it, but it is very difficult because of our population. Because in the end, marks determine if you come to a medical college and not your aptitude, and what you require for that is at least 1 or 2 levels of interviews to understand if you are actually want to do medical course and you are suited for it. So I think that is what needs to change.
See, there is a system called as mini OSCE, MMI OSCE. I don't know how many of you really read about this. This is started in Canmeds, Canada. And then I remember I was once in Melbourne where I saw this minimum as MMI OSCE conducted. There were 300 students and they were taking interviews of 30 students every day. There was about 10 cases and small cases looking at the aptitude of the student. How would you react in such a situation? What would you like as empathy? How would you really know your internal feelings and all? And then they used to mark, and that component was added to his academic component. Now, many in countries do that. In our country, I think you will find there is a corruption. And if I try to do it, I'll be influenced by many people. And courts will probably, even our NEET also, there are so much of problems which happen. So we are bound by because of this. But that doesn't mean that corruption, we should avoid taking all these kind of new concepts. They are new concepts, they are good concepts, but we are not able to implement them because of the transparency and the issues of clarity. There are no, for example, how do I give, if for this aptitude I give 8 marks and somebody I give 7 marks? Do I have a proper scale on which I do it? That would be bias. So these are kind of issues which are killing us. But we should also remember that definitely we should, over a period of time, develop a mechanism by which these aspects are considered while giving an admission to the students. That will ultimately bring back the students' attitude and empathy. Or the best, what is the solution for us? Instill attitude, empathy through various mechanisms during the course. So change the student when he has entered. If you go to the literature, there are interesting studies. There was a very nice paper, I remember, pediatric residency. Does you feel that taking a student with a particular aptitude, does he become a better pediatrician? Or changing your technique during the PG residency makes you better kind of a pediatrician aptitude or attitude? Now, if you look at the literature, there is always an evidence saying that during the residency, what kind of a training your teachers give, the way you ask them to handle, building out his mistakes, counseling, that would improve a student to a better attitude rather than allowing students to be just that. So therefore, what we are doing here, this art, humanities, attitude, communication, is to strengthen our curriculum with that. Okay, not only information. Let students build off this attitude through your curriculum. So that for that they have to spend time with their teachers, with teachers in the institutions. That if you change it, most of the things will change. When the students see empathy, when they see the death around, automatically the way they look at the patients, they will change. It's a classic example. I'll give you last 1 minute. My sister is in USA. She's a director of medical internal medicine, is a big hospital like KEM in New York. She's a director. She has 250 residents of internal medicine. She told me very nicely. She said when COVID came, everybody was extremely scared of COVID. All the residents were worried. All the faculty was worried. But when they saw patients dying, they saw the apathy, they saw the patients are coming and dying and they're all suffering. All the residents and the doctors changed and they started taking it in a very positive way. Many of them got corona, but they recovered out of that. I think it's the complete change in the attitude which happens when you look at a death, when you look at a suffering. So understanding that suffering makes you change. So I think looking at these attitudes is a very different way of looking at this. And that is a job of a teacher. He takes you students along with you, not only to make you information, but a patient treatment. If he does that, you will always respect that teacher more rather than just teaching 1, 2, 3 classrooms. That doesn't really make you love your teacher. You make you love teacher when you see him treating patients, getting their satisfaction, walking them out after a major surgery. All these are things which influence us, not only just a grand academic lecture or something like that. I think that if you understand, teacher-student relationship will change.
Thank you very much, sir. This has been a most enlightening and beautiful panel discussion, which has highlighted how, I am not saying this to flatter anyone, but this shows how nice the student-teacher relationship has been and developed because we are able to have the junior most students almost from second and first year conversing with the senior most teachers fearlessly on an open platform. So hats off to everyone for a really beautifully and fluently conducted discussion. Since we are approaching towards the conclusion of our event, I would like to invite the student speaker, Akash, to deliver the concluding lecture from the student side, followed by a concluding speech from the teacher's side. Thank you.
Okay, so shall I go first or the teacher will be going first?
No, you can speak first, please.
Okay, okay. It was I'm the last speaker for this. So I'll be starting my speech with a small, nowadays students call it meme. So everyone enjoys the language of memes. Even Mumbai Municipal Corporation has been doing it. So I have this small interesting meme, and it's directly in relation to what Girish sir said about the ethics, which is how the I'm sorry. Yeah. Okay. So how the patients change their history when they talk to the professor, and how they change the history when they give it to the students. So I think I'm going to talk about mainly two things over here: how students can take the first step, as a to change the vicious cycle and maybe create a reverse vicious cycle. So for example, in our one of our postings, what we had is that different batches had different postings. So the first batch used to enthusiastically attend it, but then exams came, so the second batch was not able to enthusiastically attend it. So the same unit teachers got a bit disinterested. So ours were the last batch. So there were hardly any lectures and hardly any students attending it. So over the batches, the teachers understood that, okay, this second year or this third year students are not going to attend. So let's not waste our energy. I think the first step should come from the students. And I'm very and extremely happy that all the professors, Girish sir, Surendra sir, Vinaya ma'am, Avinash sir, have willingly shown they are ready to take the efforts. And I feel the students here should also take the first efforts, because it's like a fundamental duty to attend classes, even if you find it boring, because the teacher has come prepared. And it I think it starts with the student first. If the student is interested, if student approaches, I'm sure teachers would hardly turn them down no, it happens normally. I think next I'm gonna talk about how thing has been raised about the exam pattern. Students are focusing on NEET exams and they are bunking their clinical lectures. I think the best way to tackle this is changing the exam pattern altogether. Maybe what Avinash sir said, having multiple exams like the MLE, or and similar on that similar lines with the MLE, we can have clinical questions exams, like audiovisual questions, where you necessarily have to attend the wards to even understand what the question or what the video wants you to do. So I think, for example, if you've seen pathology slides, you actually remember it better. So on similar grounds, if the NEET pattern is all changed, it will reflect the students' attitude towards the the teachers and the voice. They necessarily have to go there. I think next I'm going to talk about this flip classroom, and one more thing which comes with it. Okay, this will be a last point, just 30 seconds. So I think there is a lot of instances where students also heckle the teacher, and the teacher sometimes loses their confidence, or loses their interest to actually teach the students. So I think maybe allowing teachers to teach I'm allowing students to teach the batch. So that way, two things will happen. First of all, the students will actually be empathetic towards the position of the teacher. That's not easy to see 150 students in front of you staring at you and teach them. And it will also develop the teaching skills in a student and understand the topic better. I think the having smaller discussions by increasing the teachers, as Avinash sir said, maybe inviting clinical clinicians from the city, and maybe having group discussions will actually be a more personal interaction, like we used to have in 30 students in school. So I think this is how I would like to sum up and conclude this lecture from this panel discussion from my side. Thank you so much.
Thank you very much, Akash. What we notice here is that now we are moving from all the problems raised by the students towards students themselves trying to take the initiative to become the solution. So that is what is most important. It is equally important to keep identifying problems and not just pretend that everything is going well, because it is only when we notice the flaws that we will work towards correcting them. With that, I invite the closing speech from the teacher's side, please.
So, Arnav, we want you to speak. Lopa madam is going to speak.
No, sir, ma'am will not be able to join us today.
So I will speak. No problem about that.
Yes.
Okay. See, can I share a screen?
Sure, sir.
Sir?
Okay. Yeah. I would like to show you one simple thing that actually I was blessed with great role models in my life. If you really see all these people from the India as well as our colleges to across, everything really we learned from our role models and our teachers. And I think for this student teacher relationship, both of them have to take one step ahead. It's not that only one person is going to change. You know, I personally feel role models really make you, and they are the people who develop you. Satat adhyanayacha vadam paratantravalokanam tada vidya acharya sevaya buddhi medha karoganam. That means what? We have to continuously learn from all over these people. We not only have to learn technology, they have to also learn the technology. Teachers also have to learn technology. And this kind of an transfer of the vidya really helps you to really grow in your life. It's not only one lecture, but continuous lectures throughout their life really make you. I can assure you one or two things, like whether it is Lopa madam or whether it was Bapat sir. When I went to my first snow skiing course, Dr. Bapat gave me his own camera with roll filled in and say that you must do photography. I was already a surgeon that time, and he was the one who introduced the whole world of photography to me. And then I got the national honor for the photography and all that kind of thing. So it's a teacher who looks you not only in academics, but it's all around you. And he's the one we have consulted not only for the academic problems, but even our family problems, issues, career growth. So I think it's good to have mentors, good to have teachers, good to have students, because they give you satisfaction. I tell you, looking back after 40 years, I have my own students across the world heading the departments and doing so well across the world. I think that is the greatest satisfaction for me, because they have grown beyond me. I think it's a both ways. See, students learn a lot from a teacher, and teachers get great satisfaction out of students the way they grow. And you learn because of students, you learn and grow because of students. So I think it's a win-win and give-takeation. Don't lose this kind of a student-teacher relationship to a silly exam like NEET. I understand NEET is important, but these are also important parts of a curriculum and part of your growth. I think we should never neglect them. Whatever way you want to develop, as Arnab said, you may like some teachers, take them. You may not be able to do all the teachers. You know, some people you like your mentality, some of them with you. I think work them, but develop a good student-teacher relationship, because it will help you to walk through this profession, which has a lot of stresses over next few years. So I think it's worth having a good student-teacher relationship. Will not only build you, but make you grow and walk through this profession. So that's all I want to give you a message to all young students. Don't neglect this important aspect of your life.
Thank you very much, sir. I would. There is very little left for me to say after such a beautiful panel discussion, but by tradition, the moderator is supposed to deliver the closing speech.
Yeah.
So when Purva contacted me a couple of days ago, yes, ma'am.
I would like to thank, before you give any this, just two words I would like to say.
Sure, ma'am.
Thank everyone. Sir, Supesh sir, every time I hear you, sir, there is always a new insight I get. Thank you so much. I thank all my other colleagues, Dr. Surendra, Dr. Girish, for the wonderful discussion, Dr. Arnav for the excellent moderation you have done. And thank you, Dr. Amaya, Darsh, Purva, Pranav, Ojas, Mitali, Akash, for sharing your thoughts and making this experience, today's session, very enriching learning experience for me. And I would also like to say one word. Topic chosen was very thought-provoking and very relevant in present times, and is also very apt to be conducted under the aegis of Dr. Manu V.L. Kothari, chair division of human medical humanities. I feel very privileged to be a part of it. Thank you once again. Thank you, Dr. Arnav. For
Vinaya, by discussing with young students, you have become 20 years younger.
yes, sir. Definitely, I agree with you, sir. Sir, I'm so happy, sir. I'm really to share this platform with all of you all, sir. Especially you. It has been a big honor for me. Thank you, sir.
Same here. It was a great honor to listen to Supe sir, Vinaya ma'am, Surendra Shivalkar sir, and our own Arnav Tondgaonkar, not the Arnav Goswami, but he has really handled the things so well. So it was wonderfully moderated and very well. And most importantly, I think I learned a lot from the students. I'm really surprised. Like you guys are really good. The Darwin's law is still working. You guys are really much more superior. Every batch, I would say, are much more superior. Special mention I should make about Shirish Rao. I think you will become a very good teacher. I'm sure. And whatever you do, you become a teacher. You be a teacher, get attached to a college. That was really
Definitely.
nice. Thank you. Thanks again once
Thank you
more.
so much, sir.
Yeah.
Thank you so much, sir. That was a very great compliment.
Yeah.
So the thing is that for a person at my current stage of life, I have just completed my residency. I am extremely junior to the faculty members present. I am not that senior to the students present that my age would impart any greater wisdom than that which they possess. So when Purva contacted me a couple of days ago, I was really zapped. I said, for this sort of, of course, I said yes enthusiastically because I'd love to participate in anything related to KEM. But I was really wondering why she selected me for this role. And what I understand is that, I've just been through the entire grind. I've been through two NEETs, one MHCET, and all the other exams, and this time even with the COVID duties. And maybe I was put in here as a bridge between these two types of perspective. So we've come a journey even in this panel discussion. We started with a lot of problems raised by the students and the teachers pertaining to the didactic lectures and the problems that they face, the barriers to the communication. And gradually, over the course of this journey, we've started knocking down those barriers. A very valid point was raised by Sir, which really happens is that, throughout each stage of your journey, rather than enjoying what is around you, you're focusing on the next step. You're focusing on the next entrance exam, and everything is always on the horizon. Everything that you do is towards an objective rather than enjoying the course of the learning. And this is something that we have really lost, and this is something that we can get back. Because even if our careers may be defined to a large extent by the entrance exams that we give, you're still going to be one among 100 clinicians in a particular branch. What will make you special as a person is what you have gained outside that exam.
Very
So
right.
your marks and your ranks do not decide the person you are. That can only be decided by the teachers, the people that you have been with, and the teachers, including your own colleagues. And another thing that I would really like to mention to conclude is that when we say that we are part of a prestigious institute like KM Hospital, it is not the bricks and the mortar and the campus which make the place, though that is undoubtedly beautiful. It is that the wisdom of so many generations of teachers has percolated into the very atmosphere that even when you walk in KM and you take a slightly deeper breath than usual, some of that wisdom enters into you. So that is the basis of the student teacher relationship. That even when you walk around the campus of such a place, the very vibrations of the place start speaking to you and they can help you on your journey. Maybe it is not even the spoken word, but just the feeling of a place, the feeling of a person, and that will guide us throughout. And for that, it's not that, this is not there or that nobody is giving it to us and we keep waiting for this perfect teacher to appear and teach us everything. Sometimes we'll say that they're teaching us too much, they're holding our hands and spoon feeding too much. At the same time, we'll say, oh no, they're teaching us too little. So the problem is that we expect too much. Because of that, we are not ready to receive what it is that we are being given. And if we just stop for 2 minutes and open our eyes, I think everything that we require is already around us. This is what I could say at the end of my student journey at KEM Hospital. And that is something that will never end. It is something that I will carry with me personally throughout. So thank you very much for allowing me to be the moderator of this esteemed panel. And thank you very much to the organizers for a very beautifully organized event.
Thank you so much, sir. It
Thank
was amazing and it was such a wonderful discussion. A big thank you to all panelists for taking out their valuable time and participating in this unique and interesting panel discussion. We had great time hearing you all, and this discussion provided such an insight in views of both students and teachers, and it was great to hear the both sides of the story. Now we have so many solutions with us, and we are hoping that it will help us to strengthen together teacher student relationship in future. And everyone hearing this will take out so much home today. Now we'll be having a prize distribution for story writing competition, one of the online competition taken by us. So I will hand over to Nandini. Thank you.
So the surprise you have all been waiting for is here. Here are the prizes for the storytelling competition which was held by Ascension. The topics for the competition were as follows. The first topic was, as a dog, the day I saw an acid attack victim enter my old. And the second topic was, that day I realized the importance of having a good interpersonal relationship as a healthcare professional. So the prizes are as follows. The first prize goes to Devuti Sinha. Pratik, can we have the certificate? Pratik, thank you. Thank you so much. So the first prize goes to Devuti Sinha, a first-year MBBS student from the Rajiv Gandhi Medical College of Thane. The second prize goes to Nishant Birajdar. The, the second prize. Nishant is a first-year MBBS student from St. GS Medical College. And can we have the third certificate? The third prize goes to Dr. Vishnu Balkrishnan. He is an intern from St. GS Medical College. These were the prizes for the storytelling competition. Now I would like to hand over to Purva.
Hello, everybody. Actually, the discussion went on for more than we had expected, but I really enjoyed every minute of it, and I'm so glad that all of the panelists enjoyed too. Thanks once again for being a part of our event, and of course, thanks to Arnav sir for moderating it so well. Just a little thing I'd like to share is that the idea about this panel discussion sprung up in Lopa ma'am's office when we students heard about the kind of student-teacher relationship they had with their teachers, like the kind of bonding they had, the kind of mentorship they got from their teachers, like lifelong friendship that they received from their teachers. And that made us realize that what a beautiful and amazing thing we were actually missing out in our medical education. So from the bottom of my heart, Lopa ma'am, Padmaja Samant ma'am, our president, and Dr. Sunil Pandya sir, who's the chairperson of the Division of Medical Humanities, for their constant encouragement and support to conduct these unique events like these for the benefit of our students. Like, I'm really glad that we had this event for Ascension, and a big thanks to the team of Ascension 2020. Actually, this was supposed to be conducted in March, but then because of the lockdown, we couldn't conduct the offline conference. But the team of Ascension has been working so hard to conduct and reorganize it on an online platform. And yes, a big thanks to all our audience today and all the audience who have always encouraged us for all the past events too. Your enthusiasm is the biggest driving force for us at Ascension. And we hope that you all enjoyed this discussion and the previous events. So with this, I'd like to say that this is officially the end of Ascension 2020. And thanks to everybody who has been a part of this journey. Thank you.
Thank you so much. Thank you.
Thank you so much.
Thank you.
Thank you
Thanks a
all.
lot,
Thank you so
everybody.
much.
Thank you.
Thank you, everyone.
Hi, it was fun.
Good night, everybody. And I'm really glad you all enjoyed so much.
Really,
Thanks a
it was
lot.
a very enriching experience. Well done, students. Very well done. I can understand how much effort you all have done. Keep going.